Okay, good morning, everyone. If someone can hear me, can they just write in the chat just that I have sound here? Perfect. Awesome. Okay, well, we will get started. So thanks for joining us this morning for Caring for Vulnerable Populations in a Time of Crisis. Today, we're going to be talking about organizational setup and how to prepare your organization or your company for the reopening of businesses with COVID-19. So my name is Haley Moore. I'm a registered nurse here in Calgary, and I'm the co-founder of Westside Harm Reduction. So I've been working with vulnerable populations and harm reduction for about 10 years here, mostly with individuals who use substances and then along that sexual health spectrum. So just a few housekeeping items before we get started. As always, these presentations are through a grant through the Street Cred and Calgary Foundation. And then it's an initiative through the Boys and Girls Club of Calgary. So all presentation materials were created by Westside Harm Reduction, but we just like to thank Street Cred and the Calgary Foundation for allowing us this grant to deliver this information through this platform here. And then again, acknowledging of First Nations. So we would like to begin by acknowledging that the land upon which we gather today is Indigenous land. We also recognize that the traditional Blackfoot name of this place, where the Bow River meets the Elbow River, is Mohkinstsis, which we now call the city of Calgary. We would like to acknowledge that we are on traditional land of the Blackfoot Confederacy, Siksika, Kainai, and Piikani, as well as the Treaty 7 territory, which includes Tsuut'ina and Stoney Nakoda, which is comprised of the three bands of Chiniki, Bearspaw, and Wesley. Calgary is also home to the Métis people of Region 3. And then, as always, this is a safe place. So fears might look a little bit different right now as businesses are starting to reopen, and in certain parts of Alberta, we're really flattening the curve with COVID-19. But there is definitely maybe some different fears than there were initially in the fact that businesses and organizations are going to be starting to open, and what that looks like, and how can we work together as a cohesive team just to prevent the reoccurrence of COVID-19, and just respecting that any question is okay. So we actually have a fairly small group today. So if you have any questions just throughout the presentation, feel free, just either send me a question on kind of that question answer button, or you can send me a chat, and even maybe for the question answer period, we can go into, like, if you want to talk, just raise your hand and I can let that happen as well. Okay, so goals for today. We're going to go over some updates, so anything that's changed with COVID-19 in the last little bit, organizational space setup, organizational preparedness, and then any questions you might have surrounding anything we've talked about today or in the past. So COVID, again, it hasn't changed. It's still a large family of viruses found mostly in animals. COVID basically ranges from anything from severe acute respiratory syndrome, or SARS, to the Middle Eastern respiratory syndrome, or what we're seeing right now with COVID-19. In terms of cases, things are looking a little bit different here in Alberta, because we do have more recovered cases than we have active cases. So in terms of Alberta, we only have just over 1,000 active cases in Alberta, with 915 of them being in Calgary, which is why the opening and the kind of starting of opening businesses hasn't really started yet in Calgary, as it has the rest of Alberta, which we'll talk about that. In terms of total deaths, we're looking at 121 in Calgary, or sorry, not in Calgary, in Alberta, 65 hospitalizations, 10 currently in the ICU, and then the average age at death was 82. In terms of cases with Canada, we're looking at just over 72,000 cases for Canada, and just over 5,000 deaths. Alberta total cases that we've had is just under 6,500. So again, we are looking at kind of that 4,000 recovered, still with that active 1,000 cases active right now. One thing that's really awesome is we've maintained one of the highest standards for testing worldwide, which is really great. So in Alberta, we've completed just over 200,000 tests as per yesterday, which is fantastic. And then in the Calgary zone, which is where I am, and I'm sure most of you are kind of Calgary area surrounding, in terms of cases, we're looking at about 4,400 that we've had total, and then the active cases that we have right now are 915. So we are on that edge of kind of going into flattening the curve, which is really fantastic. And then in terms of updates, these are very similar to what I've talked about before. So just that we are looking at both pre-symptomatic and asymptomatic modes of transmission. So that can take up to kind of 14 days for symptoms to appear, or they may not appear at all. So I know they are asking for volunteers within like the healthcare setting in lots of places, just to be screening asymptomatic individuals to see how many people could potentially be carriers right now, just to kind of see along that spectrum of pre-symptomatic and asymptomatic individuals. And so testing has changed. In terms of nasopharyngeal swabs, they're really only doing those in the ICU or for people who are on ventilators. The nostril swab, they are really trying to get away from, just because the efficacy and the accuracy of it between staff performing that test just wasn't there. So we weren't getting as accurate of readings as they would have liked. So most places and most testing centers, at least in Calgary, are going with the throat swab. So it's just a deep throat swab that swabs both tonsils and kind of the back of the throat. I had it done a couple weeks ago. It really isn't that awful of a test if you have to get it done, or if you are a healthcare practitioner and want to volunteer if you're asymptomatic to get screened. It's not a horrible test. And in terms of testing symptom criteria right now, if you are symptomatic, they're looking at cough, sore throat or painful swallowing, shortness of breath, diarrhea or vomiting, runny nose, sudden loss of taste or smell, fever or chills, and muscle aches. So those are the testing criteria for the general public. If you are having any kind of symptoms, they will test you if you have those. And one thing I know I talked about this last week, but Alberta has created this Alberta Trace Together app, it's really fantastic app actually, that you don't have to put very much information in, just kind of like your name, your birthday, some contact information. And anyone who has this app, if someone tests positive, they can actually see who you've been in contact with, so within that 2 meters distance, so they can notify you to go get tested. So you do have to obviously have the app in order for this to be beneficial to the rest of the community, but especially if you're working frontline, it's not a bad idea for your team to all download this app, just so that if someone does test positive, then you can immediately see, at least in the workplace, who they were in contact with, which is kind of easier than writing things all down on paper, which we're going to talk about a little later, and just in regards to organizational setup. And then looking at the relaunch, so things that are changing right now. So current state, we actually are in technically stage 1 for Alberta. That's looking a little bit different for Calgary and Brooks. So the rest of Alberta, kind of all those retail services are open. So including like hairstyling, some daycares are open, restaurants are open at 50% capacity, or they're allowed to be open. I know some restaurants in certain areas have just chosen to delay their opening. Museums, art galleries. But if we're looking at Calgary, what it's looking like in Calgary right now is retail services are open. So like Chinook Mall started opening some of their services yesterday. But in terms of hairstylists, restaurants being open, they're looking at May 25th for that date. So they are doing a slower opening in Calgary and Brooks, just because this is where they're saying 75% of the cases, the active cases still are in these areas. And then in terms of museums, art galleries, daycares and day camps, they're looking at June 1st. So it's kind of that 2-week like delayed progression here in Calgary and Brooks, as opposed to the rest of Alberta. And then there's been a lot of stigma surrounding COVID-19 and getting tested and testing positive. So just our friendly reminder to everyone, just kindness is the best thing possible right now. And in order to fully flatten this curve, we need to be very accepting of people going to get tested and respecting that isolation period so that we don't get a recurrence of infection here in Alberta. Okay, so now getting into kind of organizational setup, what your organization should look like. So ideally, if we're looking at you should have a client and staff screening setup. So an area where you're screening clients, you're screening staff. Ideally, it would have an area also that some individuals could wash their hands. So ideally, this would be at the near the front doors of your organization. So a dedicated area for staff client screening along with a hand washing station. So that hand washing station could look very different in different organizations. So it could actually be like one of those makeshift sinks that people can actually wash their hands with soap and water, or it might just be like alcohol-based hand sanitizer with like over 60% alcohol-based within that solution. If possible, have the person who is screening clients and staff to be in PPE. So that's looking at a mask, goggles, and gloves. If you do have like a gown, you can put them in a gown. But if you are kind of that designated screening person, it's not a bad idea to bring just a spare, like a spare sweatshirt or some kind of overlap in your upper body clothing, just so that you can change it if you have to. And then in terms of one of the things that I like to have around kind of that screening area, especially if you have a hand washing station, is to just have like a poster for clients to be like, okay, you need to wash your hands for 20 seconds or more, and make sure you're really scrubbing, and same with alcohol-based hand sanitizer, that you're getting up kind of above your wrists. So just a guideline poster on essentially how to wash your hands, which I know that sounds very, I'm sure over the top, but it is sometimes nice just for people to have that friendly reminder of, oh, I do need to keep washing my hands. Like it's not just a quick under the sink and out. You actually have to give them a good scrub. So it's really great to have a designated client staff screening area, like right at the beginning of your building. I know last week we did talk about screening and what that looks like. So if anyone has any questions surrounding that, just let me know and we can go back through that. One other area you should have, if your staff are in like PPE, so if you're dealing with a lot of individual care, or you're in a shelter setting, and there's lots of that one-on-one care where you can't keep 2 meters distance, it's a really great idea to just have a dedicated PPE removal space, just so that you're not potentially putting viruses and infection where they don't need to be. So again, you're going to want a hand washing station there, or just some kind of hand sanitizer, just so that you can remove this PPE safely with that hand washing station. So this will limit contaminants to a single area and reduce the risk of staff potentially spreading COVID-19 to other areas of the organization. So if you have, like if we're looking at a shelter setting or an area where you have multiple floors, it's not a bad idea to have a designated PPE removal space on each floor, so people aren't moving floors consistently throughout the day, so that they can stay in one specific area. But that dedicated PPE removal space, basically what you need is just a station to wash your hands, a garbage can, preferably if it's lined, so that you don't have to be like dumping things out. You can just kind of tie the bag and throw it out. In terms of goggles, you want something that you can clean those goggles with. So if they're one use only, then you just need a garbage can for that. But if you are using like reusing those goggles, you want to make sure there's something there to clean the goggles as well, whether you're using cabbie wipes or you're using kind of soap and water, but just something that you can clean it with, as well as some paper towels so you can wipe them down after. And then again, you just need a garbage can for that mask as well. Okay, so client space setup. So if we're looking at what this space should look like when you're looking at a client's individual spaces. So say we're looking at areas where there's lots of tables and chairs, if you can keep clients' chairs and tables 2 meters apart, just to promote that social distancing. Also, if we're looking at kind of table setup with chairs, it's actually best if chairs are sit like side by side instead of having like one person on either side of the table, just to prevent that spread of, like if someone's moistly talking or kind of that droplet spread. It's better if there's that 2 meters beside each other instead of in front. For that, in terms of clients' sleeping spaces, you're going to want to make sure those beds are as far apart as possible. So kind of that 2 meters distance if you can, and if not, kind of doing that head to toe aspect. And I know a lot of places are doing kind of 2 meters plus head to toe. So you're just alternating how individuals are sleeping just to get even more space between them. If possible, have an isolation area in your organization for symptomatic clients. So if someone is coming in and the screening person deems that they're a positive screen, just somewhere where that individual can go until kind of everything is put in place, whether you're contacting as is or you have an isolation floor in your area, if it's at the DI or Alpha, just to get that individual kind of to a safe space to prevent the spread of infection. Also, if we're looking at client space setup, when we're talking about screening, encourage one person to enter the site at a time. Whether if you need to put signage up for that is a really good idea, just so you don't have multiple people coming in at once and kind of disregarding that 2 meter like social distancing aspect. And another thing that is really important if we're looking at prevention, so I'm going to talk a bit about prevention on just how we can make this better for staff and for clients. One of the biggest things is going to be communication. So notifying employees and volunteers on the steps being taken just in that workplace to prevent the risk of transmission. So that could be like even just hand washing, making sure there's information sent out to staff about hand washing. Looking at if you need to send out information for how workers are getting to work. So if we can mitigate risks when commuting to and from work, so like carpooling, public transit, buses, that kind of thing. If you know how people are getting to work, that's a really great way to start. Sending out information on how to mitigate those risks when you're at home. So the transmission in homes and shared living accommodations, just any kind of communication you can send out to your staff is really beneficial. And then especially because businesses and organizations are now opening, sending out that information to staff on how to mitigate those risks while you're at work. So what in the workplace are you doing to prevent the spread of COVID-19 now that things are open? That's really going to reduce the anxiety with staff and with clients if they have kind of, okay, this is what we're doing, these are the steps we're taking, and just that clear communication is there. So you can post this information in areas where employees and volunteers or clients can refer to them. And then just making sure everyone is aware of kind of that order that was placed in May. So it's 052020 if anyone cares, that's the order number, but just requiring individuals who have returned from travel outside of Canada to be in isolation for a minimum of 14 days. And then also anyone who is showing symptoms to making sure they are self-isolating at home and then getting swabbed and going through those proper channels and not returning to work until they do have a negative swab or symptoms resolve, whichever takes longer essentially. Okay, and prevention. So staff client screening, this, I know we talked about this kind of last week, but going through those questions. So do you have a new or worsening fever, sore throat, cough, shortness of breath, runny nose, muscle aches, any of those symptoms that we talked about earlier? Or have you been in contact with someone who is a probable or confirmed case of COVID-19? So those are some questions that are really important that you're asking staff and clients. And when I say, have you been in contact with someone who's a probable or confirmed case of COVID-19? This is without proper PPE. So if you're working at an organization where they do have an outbreak or a very perceived concern for an outbreak, if your employees or yourself have been in proper PPE while they've been in contact with that person, then it's not deemed to be close contact because you were taking those proper precautions. And then some organizations are doing this. It really isn't a bad idea to take clients' temperature prior to entering your organization. And I know a lot of organizations are doing that with staff as well. So a staff and client temperature check as they're coming in is really fantastic. Just so that organizations are safe and you're really taking those proper measures to mitigate those risks. So if someone does have a positive screening, I'm just going to quickly run through what happens if an employee does come to work or staff does come to work and they are sick or they become sick at work. So employees, volunteers, anyone who's in the organization who appear to have any kind of ILI or influenza-like illness symptoms upon arrival to the workplace or become sick while at the workplace should begin to isolate at home immediately. So they shouldn't be finishing off their shift. They should just be going home and requiring that kind of self-isolation. So one of the things is after being directed to leave the business, symptomatic employees should follow like hand hygiene. So they should wash their hands before they leave. They should wash their hands when they get home. And then obviously maintaining kind of that respiratory etiquette. So covering your nose when you cough or sneeze or using a tissue for that, maintaining at least 2 meter distance from other employees, volunteers, even on your way home. So arrangements really should be made for that individual to get home without coming in contact with anyone else. So if your employees are taking public transit like buses or taxis or ride sharing, that essentially should be avoided if possible on the way home. So once the sick individual has left the workplace, you need to clean and disinfect all surfaces and areas that they may have come in contact with. So this could be done with like Cavi wipes or Excel wipes or any 60% bleach solution that your company is using. I know in the picture there it has a spray bottle, but if your company or your organization is using a spray bottle, make sure you're spraying it into a cloth, because if you're actually just spraying that spray bottle kind of like into the air, it's actually considered an aerosolizing procedure, so it can bring back up any potential COVID-19 particles that are on surfaces. So just make sure you're spraying it into a cloth to mitigate those risks. So again, if someone does come into the organization who is sick, as staff, as an employer or an organization should actually consider recording the names of all close contacts that individual has been in contact with that day and 48 hours prior to the day that they became sick from when those symptoms started. So this information just might be necessary when they're looking at contact tracing. That's one of the reasons that app is really fantastic if you're wanting to implement that in your workplace, because that really, if all your employees have it or everyone in the organization has it, then you actually know who's been within kind of that 2 meter contact. And it might kind of reduce the workload for keeping track of where employees have been and what rooms they've been in and who they've been in contact, that kind of thing. And then make sure that employee is calling either 811, or if you're looking at workplace health and safety, filling out that self-assessment tool found on Alberta Health for if you're in frontline or healthcare. It's actually a really easy like screening tool to fill out. And actually at the end of it, which kind of reduces the amount of calls that are being put into 811, is it actually asks for your information. So it asks where you work, if you're working frontline or shelter, what's your role, your public health or your PHN number and a phone number. And then someone actually from HealthLink gives you a call and sets up your test. And it's really quite fast. When I had to fill it out, I was literally getting tested the next day. They called me maybe 2 hours after I had submitted the form. So it really was very efficient rather than having to wait on hold with 811 for however long. I know it's probably a little bit faster now, but I know at the beginning it was quite extensive for how long you needed to wait. Okay, so if we're looking at prevention, what can we do as staff? What can we do as an organization to really mitigate these risks? So hand washing, make sure there are enough supplies for proper hand hygiene. So soap, paper towels, warm running water, or if you're using alcohol-based hand sanitizer, making sure you're having enough of that. But if you are using alcohol-based hand sanitizer, make sure there is a place for employees to, whether it's just the washroom or whatnot, to wash their hands with soap and water. Just because alcohol-based hand sanitizer doesn't work in the presence of dirt or like visually soiled hands. So if you can see dirt on your hands, if you're putting alcohol-based hand sanitizer on it, it's actually not working because it doesn't have the same effect when it's in in contact with dirt. So if you do have visibly soiled hands, you do need to actually scrub your hands to get that disinfectant effect. Make sure there are some kind of Kleenex or tissues for client use so that they can practice proper respiratory etiquette. So that's for staff and clients. If we're looking at garbage cans, I know I said this earlier, but make sure they are lined. So make sure they do have like a bag inside it, so you don't have to be touching anything that's in the garbage, especially with like your PPE. Make sure those are lined so you can just pick them up, tie them, and chuck them out, so you're not exposing yourself to any of those potential infection particles that are in the garbage can. If you do have like a non-touch garbage can, like something you can put your foot on, that's fantastic. That's fantastic as well. Signage is really important. So that can be posted through your organization, just reminding staff and volunteers and clients about COVID-19 and hygiene and any steps that organization is taking to mitigate risks. So if we're looking at kind of washrooms, toilet or bathroom facilities, if they're shared, consideration should be made just in these areas, making sure that you're sanitizing high frequency touched areas. So like taps, and if you don't have automatic flushers on your toilets, make sure you're kind of wiping down toilets. And they are recommending doing these like twice a day or when soiled, but just making sure it's a routine practice right now, kind of in your organization, to make sure like you're really washing down high touch areas. And if you can stagger kind of bathroom times, that is ideal as well. And then if we're looking at kind of physical distancing, so making sure within your organization that there is kind of that 2 meters between individuals. So that can be like, if we're looking at bathrooms, that can be like decommissioning certain stalls if they're not 2 meters apart. Staggering entry to locker rooms and showers so that fewer users are present at a time. And since the virus spreads through droplets, so the infection is actually there, it's actually a very large particle, so it weighs quite a bit. So it once it's like left your body, it actually drops quite fast, just because it is heavy. So if there's like shared showers, anything like that, there's actually a minimal risk to transmission through that, just because those particles do drop quite fast. But it is a great idea, obviously, to keep cleaning it and make sure that those cleaning practices are up to date. Mattresses. So mattresses should be cleaned and disinfected between clients, and clean bedding should be provided to new clients, just to reduce the risk of contaminants. And then if you are providing towels or any kind of shower essentials for individuals, just make sure, obviously, clean towels should be given to each client, and advise not to share those towels. And one thing certain companies are recommending, so this is with kind of the Alberta protocols for relaunch, they are recommending having a visitor log. So having a protocol for maintaining up-to-date information, but also something called a visitor log for rolling out 6-week inventory of all people visiting the work site, including like full names, addresses, phone numbers for all staff. So when staff have been at work and what area of work they have been working into. So particular attention should be paid and recognized to recognize instances where multiple workers reside in the same location. So if you have multiple floors or multiple areas within your organization, the people that are working in close contact with each other, that should be documented. So check-in and check-out procedures for all staff, staff work assignments, so making sure you're knowing where they're working. It is a really good idea in that visitor log to document how they get to work. So whether it's they carpool, they take public transit, they drive alone, it is just good to know what contact they have been in contact with. You also need to do this for contracting individuals or like any kind of visitor information. So delivery drivers, repair workers, anyone who's coming into the site, you should be documenting their names, their address, their phone numbers, so that people can get in contact with them if you do have an employee that comes to work ill, or you have a client that comes in that's ill, that comes in contact with people. And this is where that app would really mitigate some of the work that's involved with this visitor log. So if all your employees have that app, essentially it's through a Bluetooth, so it recognizes when it's been in contact with when your phone has been within 2 meters of someone, and then it records. So if, say, you test positive or someone in your site tests positive for COVID-19, public health and CDC, so people that are doing the contact tracing, will actually ask for that information from your phone. You'll sign a release, and then they will have access to anyone you've been in contact with within that 2 meter spectrum. Cleaning, the joys of cleaning. So cleaning refers to the removal of visible soil, so things that you can see. But cleaning doesn't necessarily kill germs, but it's highly effective at removing them from the surface. So it's really good for organizations to be using what we call a 2-step program, or a wipe twice method. So if you're wiping surfaces with a cleaning agent, the first time you're actually doing that to remove like any dirt or debris or any soil that could be on that surface. And then the second time you wipe it with a clean, either cloth or cavity wipe or Excel wipe, whatever your organization is using, that's actually what will disinfect that surface. So it is a really good idea to implement that 2-wipe procedure, especially when we're looking at high traffic areas, like common areas, public washrooms, showering facilities, like light switches, anything that is a high touch traffic area, like doorknobs, obviously toilet handles, faucet taps, elevator buttons, railings. Encouraging staff to be cleaning their phones, their computers, keyboards, anything that they touch frequently. And that includes when they're leaving the site too. So anything that they frequently touch, like their ID badge, their personal cell phone, make sure they're giving it a clean with even just like an alcohol swab before they leave the site, so they're not bringing any of those potential contaminants home to their families and their community. And one thing with cleaning, especially if we're looking at certain organizations that maybe they're working with kids, maybe they're doing therapy with kids, anything that can't be easily cleaned, so like newspapers, magazines, stuffed toys, that kind of thing, you should actually be removing them from the area for now, just so that we can properly clean anything that we're coming ourselves or clients are coming in contact with, just so that we're reducing that spread of infection. So if you can't properly clean it, just make sure it's not out and in an area where it's frequently being touched. So organizations that are preparing food, so there is some food preparation tips that have been released by Alberta and BC just to help reduce the spread of infection. So in those food areas, making sure that there is, again, that waterless hand sanitizing. If you do have like soap and water, that's fine too. The hand sanitizer just kind of speeds that process along, so it makes it not as slow. But making sure people are washing their hands before meals, just with an alcohol-based hand sanitizer. Dispensing food onto plates for clients. So avoiding clients like serving themselves, just so that they're not coming in contact with like any kind of serving tools, just keeping one food handler for that. Minimize client handling of multiple sets of eating utensils. So you can provide either like individually wrapped eating utensils and having staff hand those out. Removing any kind of shared food containers. So that could be like water jugs, coffee cream, salt, pepper shakers. So if you can get individually packaged items for that, that is ideal, just so again, so we're reducing that high traffic touch volume areas. If you can use prepackaged snacks when possible, or prepackaged meals. So I know like lots of places, they're just bagging their lunches and giving them to clients, just so that to avoid coming in contact with any kind of food handling aspect. Making sure there's adequate space between clients when they're eating. So again, that 2 meters, but if you can have them side by side instead of kind of in front of each other. Ensure staff that are handling the food are practicing good hand hygiene. So they're doing that 20-second hand wash with soap and water. They're using alcohol-based hand sanitizer. They're not going from room to room. So essentially, if possible, staff assigned to, like, say, housekeeping duties shouldn't be involved in food preparation or food service if possible. I know that sometimes that's in a perfect world, and that sometimes just isn't the case. We, especially working with vulnerable populations, we all have multiple roles. So just making sure that proper hand hygiene is performed. And then kind of after meals and before meals, making sure that surfaces are fully cleaned. So tables, chairs are disinfected after every meal. And that includes like high touch areas as well. So door handles, if you are using like individual salt and pepper shakers, or you do have a communal water jug, making sure that's being wiped down frequently as people are using them, just to prevent that spread of infection for individuals here. Okay. So in terms of kind of clients, like organizational setup, that's really the guidelines that they have been putting out, and best practice for organizational setup. Again, we, as Westside, we still have these lovely infographics if anyone wants them. I know, I'm sure people have seen these so many times now, but I can send them to anyone who doesn't already have them. But we'll get into kind of our question answer period. So if anyone has any questions about organizational setup or anything just revolving COVID-19, please feel free. You can write it in the question answer box, or you can just send me a message on the chat and we will get them answered for you. Also, one thing I did want to just put out to everyone who's on this webinar today is this is actually our last COVID-19 webinar in this series. However, understanding that we're still not kind of at capacity to be going out and doing full education. So with Westside being an educational company, we typically focus around kind of drug trends, overdose response, STBBIs, harm reduction based training, and we usually do that in person. But since we really don't have that ability right now, we are going to be doing some webinars surrounding different things. So I did create a poll if anyone wants to just answer it. If there's any information that you would like to have more information on, you're welcome to just answer this poll. So it's really, if you want more information on COVID-19 in the community setting, we can do that. Drug trends or drugs of abuse, overdose response and naloxone, and then just harm reduction training. So if anyone is wanting any more of those trainings, you can just put them in kind of this poll, and we will get some of them set up for people so that people can have some of this training online right now that they can share with staff. I'm just seeing if any questions here roll in. There we go. Okay, so our office has computers available for clients to use. How is this suggested to be implemented? So with computers, just making sure they're 2 meters apart from any other client. So if you can practice that social distancing, whether you need to block off some like certain computers if they're all kind of in a row, and then making sure you're cleaning them after each client has been present. So either cleaning them with an Excel wipe, so that's kind of the keyboard, the monitor, like anything that could be touched in that area. And also just like wiping down the booth that the computer's on, wiping down that chair. So giving a full clean after each client has used it. It's not a bad idea to just have, either if you can, have hand sanitizer present when they come in, so you know their hands are clean before using the computer. But really, yeah, it's just making sure they're 2 meters apart and then cleaning them after each individual use. And I know keyboards can get a little gross to clean, but I find if you just kind of like shut off the computer and give it a a good scrub, it works quite well. Okay, should single-use bathrooms be cleaned after every use? To be honest, that really is going to depend on the capacity you have within your organization. The recommendations for bathrooms right now for Alberta and BC is that you're cleaning them twice per day, like giving them a good clean, and then cleaning them when soiled. So if you notice that there's actually visible dirt, cleaning them. But in terms of those kind of like high touch areas, so the like toilet handle, the faucets, you could probably have someone go in there and give those a quick wipe down like every couple hours, but you don't have to clean them after each use. At least those aren't the recommendations that the Alberta Relaunch program is putting out. Okay, we'll give it a couple minutes here for any more questions to roll in. As always, if you do have questions that pop up throughout the day or throughout the work week, you can always send me an email at info@westsideharmreduction.com, and I'll do my best to get back to you as soon as possible. We will be doing another webinar next Friday. So judging by the poll, most people are wanting like information on drugs of abuse or drug trends. So we will go through that. So that will be next Friday. So I will send out a link for that. So what that usually entails for us is we'll go through a lot with how opioids present, how methamphetamines present, and then what we're seeing on the street right now. So and how you're going to want staff to respond in certain areas. So it will probably be like 45 minutes to an hour for that presentation, but I will send out the link for that, but that will be next Friday.